is an inflammation of the meninges, the outer dura mater, middle arachnoid, and inner pia mater. The last two called leptomeninges. These meninges cover the central nervous system, including the brain and spinal cord. Meningitis can be caused by various agents: viruses, bacteria, fungi, and parasites. Examples in meningitis viruses include enteroviruses and arboviruses. Fungi examples are Cryptococcus neoform. Meningitis can also result from non-infectious causes. These include inflammation, brain surgery, and traumatic injuries. As mentioned, viral and bacterial meningitis are the most common types. They're considered the most important due to their frequent occurrence. Viral meningitis is caused by viruses like Entero, HIV, HSV, and arbovirus. The main cause of viral meningitis is the enterovirus. Compared to bacterial, viral meningitis is more common but less severe. It's more frequent in summer and early fall in cooler climates, year-round in warmer ones. It's most common in children under 5, especially in their first year. However, viral meningitis can also occur in other age groups. The virus reaches the central nervous system via infected white blood cells. Resident immune cells try to prevent meningeal inflammation. When the virus contacts the CNS, it quickly enters the brain and spinal fluid. Present cells produce cytokines that reduce vascular integrity, making it more susceptible to infections. This process varies depending on the virus type. Viral meningitis, caused by HSV, originates in oropharyngeal cells. The virus spreads to lymphoid tissues, infecting cells and potentially forming a reservoir. Herpes virus can also infect brain blood vessel endothelial cells, causing latent infection. When stressed, the pathogen may reactivate, triggering a broad inflammatory response with cytokine and chemokine release. Transmission and contamination vary by virus type. Enteroviruses spread through touch, then touching eyes, mouth, or nose without washing, or by eating contaminated food. Bacterial meningitis is caused by bacteria like Meningitis, Streptococcus pneumoniae, Villus influenzae. However, the main cause of bacterial meningitis is meningitis. Compared to viral meningitis, bacterial meningitis is less common but more severe, with a higher mortality rate. While it affects young people and adults, it's more common in children under 5 years old. Meningococcal disease caused by Meningitis is characterized by acute bacterial meningitis. Acute bacterial meningitis starts in the nasopharynx, then bacteria multiply in the subarachnoid space, releasing components that inflame the brain's endothelium. Increased vascular permeability leads to inflammation in the subarachnoid space and higher resistance to cerebrospinal fluid flow, raising intracranial pressure, reducing cerebral flow, and impairing cerebrovascular autoregulation. Bacterial meningitis can spread from person to person through respiratory routes, including cough droplets, sneezes, and nasal secretions. Those most susceptible to contracting the disease are individuals with compromised immune systems, such as children under 5, people with immune system disorders, pregnant women, and those in crowded enclosed spaces. While anyone can contract meningitis, certain factors and habits can increase the risk.
To discuss Brazil's epidemiological profile, I referenced an article in the Brazilian Journal of Health Review on meningitis from 2018 to 2022. Authors are detailed in the article. The left graph shows an analysis of the total 61,126 reported cases during this period. Notably, 2018 had the highest number of cases at 17,593, about 28.78% of the total. In contrast, 2021 had only 11.2% of reported cases, less than half of previous years. Sharp decline in 2020 and 2021 likely reflects underreporting due to the COVID-19 pandemic peak. The right graph uses variables of individuals' sex and time period. Of the 61,117 reported cases, males were more frequently affected. Once again, 2018 saw the highest number of cases, 28.57% for males and 11.15% for females. In contrast, 2021 had 11.17% of cases across both genders. This was the year with the fewest recorded cases, likely due to underreporting as mentioned. On the left, we see annual meningitis cases in Brazil by age group. The 20-39 age group was most affected, accounting for about 20.13% of all cases, but it's noteworthy that there's high incidence in groups under 1 year old, 1 to 4 years old, and 40 to 50. This allows us to analyze and protect the most vulnerable age groups. The right table shows that most meningitis cases, 70.03%, result in hospitalization. The next highest figure is deaths from meningitis, totaling 8.84%.